Why are my periods so heavy? So when you have heavy periods, they'll often feel like Niagara Falls, and it will often look like a crime scene. There's so much blood there. Now let's talk about the reasons why you can get heavy periods and what a heavy period typically looks like. This is an important one to cover because I find that when I have patients come to me, there can be some confusion over what a heavy period looks like, and it's no fault of theirs. It's just that, we don't sort of have anything to compare it to, and we quite often don't know what that actually looks like. So that's what we'll be covering in today's live. So I'm very thrilled to have you here today. My name is Michelle Cooke, for those of you that don't know me, and I am a period and hormone naturopath. I'm a natural fertility educator, and I'm a practitioner, so a naturopathic emotional release practitioner. And basically I help women struggling with their menstrual cycles have easy, pain-free periods, emotional well-being and hormone balance. And I'm based in Melbourne, so I see patients online and face-to-face. So as we go along through the live today, if you have any questions at all, please be sure to pop them in the comments box down below, and I'd be more than happy to answer those for you. Also, if you're enjoying the content, be sure to hit likes and loves so that I know that you're enjoying it. I know that you're here with me and that I'm not just speaking to a camera on my phone and laptop. So what does a heavy period look like? So let's go through that today. I've just got my notes so that I stay on track because I have a habit of rambling on if I don't have them, or going like a deer in headlights when the camera's on me. So let's go through it. So a heavy period is also known as menorrhagia. Okay, and this is when you're losing more than 80 milliliters of blood over the duration of your whole period, okay, so from start to finish. And that's all well and good, but you're probably thinking, well, what does 80 mils look like? How am I going to know that I'm actually losing 80 mils of blood? So let's go through that. So quantity-wise, think of it this way. So when you're having a shot of alcohol, that's normally 30 mils or 30 milliliters. So it's essentially 2.5 or roughly of those in terms of the amount. Or in terms of kitchen utensils, it's more than 5 tablespoons of blood. So a tablespoon roughly contains 15 mils or 15 milliliters. So it's roughly more than 5 of those, or about 1/3 of a cup in terms of kitchen utensils as well. This can be quite easy to measure as well if you are using a menstrual or period cup, because there is often little milliliter increments down the side of that period cup, so you can easily quantify it and actually tally up those amounts to get your total amount over the duration of that period. So that's a really nice way of doing it, just so that you know how many milliliters you're losing. And different period cups hold different amounts, and within one brand there may be different models, and some hold a bit more than others. So you'll just have to look at the period cup that you've got and see what milliliters are along the side there and go along with that. Now, tampon wise, what does it look like to have a heavy period? Well, regular tampons actually hold approximately 5 milliliters of blood, okay? And super tampons hold about double that, so approximately 10 milliliters of blood for the super tampon. So if your period was actually heavy, you would be using approximately more than 16 regular tampons over the duration of your whole period. Or that would equate to 8 super tampons over the duration of your whole period. So you're using more than that. So pad wise, it's quite similar to the tampons. So in terms of pads, a regular pad holds approximately 5 milliliters or 5 mils of blood, and the super pad holds approximately 10 mils or 10 milliliters of blood. So in terms of pads, if your period was heavy, you would be using approximately more than 16 pads. Okay, so more than 16 pads over the duration of your whole period, or more than 8 super pads over the duration of that whole period from start to finish. So day to day, what would that actually look like for you? So it might mean that during the night you're actually having to get up and change your pad or tampon because it's full, not because of hygiene purposes, but because it's actually flooded with blood. When you go to bed, you're actually having to put a towel down as well underneath because it actually leaks and overflows depending on what menstrual option you're using there. The blood flow is actually so much that you're finding that you're having to change it every 2 hours or less. So you're having to change the pad or tampon every 2 hours or less. That's equivalent to it being heavy. Okay, so generally speaking, sort of every 3 to 4 hours is considered normal if you're having to change your pad or tampon then. And generally you're doing it to sort of prevent any, for hygiene reasons, to prevent infection or toxic shock syndrome, things like that. You're finding that you're bleeding through your clothing. That's another sign of heavy periods as well. And you're having to wear large maternity pads at night time because your blood flow is quite heavy. You're having to double up on menstrual options. So I know a lot of ladies do this, and it doesn't necessarily mean that you have heavy periods, but what I mean is, for example, you might be using a menstrual cup alongside period undies as well, but it overflows through both of those, just as an example. Another option might be you might be actually using that menstrual cup alongside a pad as well. So you're doubling up there because it's overflowing through both of those. It's not just as a backup, because there's lots of women that will use a menstrual cup and then wear period undies because there might be a little bit of leakage, but it's not excessive. I hope that makes sense. That's a little bit different. So in that case, when it is excessive and it's spilling over both of those menstrual options, that is considered to be a heavy period. Now, when your period goes for more than 7 days, that can be classed as heavy as well. And if you're passing blood clots that are larger than a 50-cent coin, that could also potentially mean that you've got heavy periods as well. So it just gives you a bit more of an understanding of what heavy actually looks like in terms of quantity and in terms of what it looks like day to day. So let's move on. So why do I have heavy periods? So there's lots and lots of different reasons why this may be the case. So we need to remember that sometimes heavy bleeding can actually be due to reasons extending beyond the reproductive health system. So we need to keep that in mind as well. There can be other causes. It's not always going to be due to your reproductive system. So some conditions where there may be heavy periods, so it can be in the case of PCOS, for example, so polycystic ovarian syndrome. And this is a syndrome where 2 out of 3 of the following things are happening. So there may be irregular or no periods. There may be signs of high androgens, either through your symptoms, so there may be acne, there may be hair loss, there may be excess hair growth either on the face or the body, or there could be high androgens actually in your blood test. Another finding, so remember it's only 2 out of 3 to actually constitute you having polycystic ovarian syndrome. So the third one is polycystic ovaries, but you don't always have to have polycystic ovaries to have polycystic ovarian syndrome. So I hope that makes sense. So when you have polycystic ovaries which are visible on the ultrasound, you may have sort of more than 20 partly developed follicles there, or the ovaries, either one or both, may be increased in size by about 10 mils. So that's usually how it's sort of diagnosed based on 2 of those 3 criteria. Now, the other condition would be endometriosis. So that's when tissue that looks like the uterine lining is growing somewhere outside of the uterus, okay? So there's a lot of pain and inflammation as a result of that. I spoke about that quite a lot in the last live in terms of endobelly, so just make sure that you check out that one as well. Fibroids, so these are non-cancerous growths, so they can grow within the muscle of the uterus, and they can also protrude inside the uterus as well. They can be attached to a stalk and actually protrude inside that uterine lining into the uterus itself. So adenomyosis, so that's when the tissue that normally lines the uterus is actually growing within the muscular wall of the uterus. So a lot of issues as a result of that as well. Uterine polyps are another type of non-cancerous growth that's attached to the uterus as well. There's also hypothyroidism. So hypothyroidism means that your thyroid is under-functioning, so it's functioning slower than usual. So that can be another reason for having heavy periods. Uterine cancer as well. So that's basically cancer that's located in the uterus. Other reasons, so remember I mentioned earlier that it could extend beyond that of the reproductive health system. So there could be during perimenopause as well. That can actually, you can have heavy bleeding on that sort of rocky journey towards menopause. Anemia, so ironically, low iron can actually cause heavy periods, but also it can be a result of heavy periods as well, of course, because your iron is quite depleted with that heavy flow. Blood disorders is another one too, and excess estrogen as well. So that could be relative to progesterone. It's looking like there's more, or there's actually more there generally. So what should I do if I have heavy periods? So this is what I'd recommend. So if you're experiencing heavy blood flow and you're quite concerned about it, I would definitely recommend making an appointment with your GP to investigate what's going on. And quite commonly they will usually refer you to a gynecologist for further investigation if required. And a gynecologist specializes in reproductive health. So we need to remember that a doctor or a GP is very general, and the experience that they have is over a whole range of different general concerns. Whereas a gynecologist is more specific in that they help with female health disorders and reproductive health. So I would definitely recommend doing that to investigate what's going on and get diagnosed properly. The other suggestion that I would recommend is actually seeing a naturopath that specializes in periods and hormones and menstrual cycles like myself. So they need to be part of your healthcare team as well. It's very much a team approach in terms of treating reproductive health and periods and that sort of thing. So I would very much recommend doing that and making sure that they're a part of your team as well, because it's a different approach to what a GP or specialist would do, and we work so well collaboratively together. So in terms of working with a naturopath, what would be involved? Okay, so Basically, I would look at what's happening with you as an individual. If you've been to a GP or a gynecologist and you've got that diagnosis, that's great. We can do supportive things with diet and lifestyle. We can use nutritional medicine, herbal medicine to actually help with your hormone balance. We can look to see if there's any nutritional deficiencies through pathology testing as well that are contributing to your heavy periods or your hormone balance or whatever's going on. So it's very much looking at sort of the causative factors as to why that heavy bleeding is actually happening for you. That's what a naturopath is looking at. Just give me a second. Yeah, and as I mentioned before, it's looking at the root cause of what's actually happening for you. Whereas a GP is trained differently, and they look at things in terms of, they're very, very good at diagnosis. So diagnosing if you have a particular condition, helping you with symptom management and things like that, where a naturopath is actually addressing why that's actually happening. So you can see why those two things work really, really well together. And at the end of the day, obviously we want to address the heavy bleeding and we want it to stop because it's going to deplete your iron stores and all that kind of thing. But it isn't sort of the total, it shouldn't be your complete total management of heavy bleeding. We need to find out why it's happening, what's going on, what's contributing to that. And what preventative measures we can put into place to actually stop it from reoccurring again. Simply using a band-aid approach and sort of stopping the bleed and turning off the tap isn't enough in my experience and knowledge. That's why I definitely recommend going to a naturopath as well. Now, okay. And I have mentioned sort of how I treat that. So basically, I'd be using herbal medicine, nutritional medicine, diet and lifestyle advice. I also use a technique known as naturopathic emotional release, which actually addresses any underlying causes to your heavy bleeding or the condition that you present with, which is it's an extremely important part of your healing. What you're presenting with is more than just a physical thing. We need to look at underlying emotions as well. Very, very important. So is there any questions just as we're going through for the minute? Let me just double check on Facebook as well. If you think of something and you're too shy to actually ask it, you can always send me a DM or a PM later. That's totally fine, and I'm more than happy to answer that for you. So I guess that sort of summarizes what I would like to speak to you about today. If you're experiencing heavy periods and you would like some support from a period and hormone naturopath, I would absolutely love to help you. So what I would recommend is booking a free 15-minute discovery call with me to see if we're a good fit and to understand how we would be working together and whether that's something you'd like to pursue. So basically, if you're watching on Instagram, there's a link in my bio to book. If you're watching on Facebook or YouTube, I'll pop the link down below for you. And I would like to thank you so much for watching. If you're watching on my YouTube channel, be sure to like and subscribe. Also, I'd like to mention that all of these lives are actually on my website. So if you head to reproductivewellness.com.au/blog, they're all there. So all the videos are there and the written explanation underneath as well. So you can always go and check those out later. And yeah, I would like to wish you a very pleasant evening. And FYI, I go live every single Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking all things about periods, hormones and menstrual cycles. So I look forward to seeing you next Wednesday. Thank you so much. Bye. Bye.